welcome to Young at Heart. I'm Tammy, and I'm here today with Ken Lehman, who is the Director of Outpatient Rehabilitation at Plymouth Rehab and Healthcare Center in Plymouth, Mass. Hi, Ken, how are you?
I'm doing great.
I'm really excited to have you here today, and to let everyone know, I actually do an internship at Plymouth Rehab, so I've had the opportunity to see what they have available to the public. And one of the exciting things that they have, besides the regular nursing home rehabilitation and brain injury units, is the outpatient rehabilitation program. It's fairly new.
Yeah,
Correct.
so the program's been, it's got started in spring of 2014, and I came aboard in September. So I started September 8th, so I've been there for 3 months, and it's going great.
If we had to ask what the goals are for your rehabilitation center, could you elaborate on that a bit?
Sure. So, we are in Plymouth, and it's a very dense area as far as rehabilitation services. There's the hospital, formerly Jordan, which is now Beth Israel Plymouth, and there's a lot of private practices around. So I think it's important that to come in as a physical therapy, as far as outpatient, we really need to specialize or be something different. And the way that we're different is really on our one-on-one time with our patients. So we spend a lot of time with our patients. We have a lot more one-on-one time as far as the supervision, taking the people through. And I think that's really what's allowed us to grow. The big thing about Plymouth, which is really good, in our inpatient side, is that we have a diverse group of patients. We do pediatrics, geriatric therapy, we deal with orthopedics, joint replacements, and by taking that diverse group of therapists, they're able to follow people from the inpatient side to the outpatient side. So in a sense, we do also offer a continuum, but it's also great for people who come from the outside. So someone might have had a knee surgery, or their shoulder's hurting them, or they're having trouble holding their grandchild. They can come to us from the outside, they get a script from their doctor, and they come see us. So we're able to utilize a large, vast group of therapists and specialists that are already there, as well as myself. And outpatient's really what I've had expertise and time, and that's where I've spent most of my career.
That was something I also wanted to ask, was how did you get to be where you are today? What have you done in your background or schooling?
Well, the way I really got into physical therapy was actually to start to be a patient. I raced motocross and I played sports all the way through grade school, high school, and into college. And I always knew I wanted to do something in the sciences, but I really wasn't sure. I've been blessed to always be a good student. I was able to keep my options open. But I had a significant injury to my leg, and it took me a long time to get back. And I was close to having an amputation. And I had a lot of pain, and I had great surgeons. I'm lucky to be here in the Northeast and in the Boston area. And I had great trauma surgery. But that was only 50% of the puzzle. There was a lot of doubt afterwards, whether I would get back to sports or even be able to walk with a limp. And I was young, so it was tough on me. And what really brought me to that next level was that good one-on-one physical therapy that took me through, gave me the confidence, gave me the tools, and really the self-know-how and knowledge to get back. It took me a long time. It took me about 18 months to get back on my feet. And after that experience, it really it pushed me to go beyond that and go to physical therapy. So I was at Assumption College when I got hurt, and I was a biotech major. Basically keep my options open. I wasn't sure if I was going to go to med school or I was going to do research. But after my experience in physical therapy, that I really felt like that was my calling. So sometimes some difficult things happen in your life, but I think for me, that really set me on my path, and so I'm grateful for that. So I went to Simmons College and I entered the doctorate program. And that was 3 years, including some internships. And I started with private practice, outpatient physical therapy. I worked for a local company as a staff physical therapist starting, and then I worked my way up the ladder and became a director. And I started directing a smaller clinic in the Quincy area. And then I opened a few clinics for them, other places. And then I began running their largest clinic in the South Coast area. I'm from Plymouth. I'm here born and raised, so I'm excited to return. Excited to say me and my wife just had a child not too long ago in April. His name's Henry, and that really pushed me to look for something local. And I happened to come across some great people, Plymouth Rehab and Healthcare Center, and they've given the opportunity to allow me to grow with their program, and they valued my expertise and the time I had had in the other clinics. So we're really starting to grow this, and I think I have great support. They've been really receptive to, taking on some of the equipment that I thought was necessary, the staffing, and they've been great. So we're really just starting to grow, and everyone who's been to us, I think, has been very happy. I think the big thing is just getting the people in and make them aware of us. So I appreciate the opportunity today to be mentioning the clinic.
Oh, absolutely. One of the things that I kind of wanted to touch on is when you do go to the doctor, and whether you hurt your wrist or your knee or whatever, and they give you the list of places that they recommend, you don't have to use that list. You could really go almost anywhere you want, right?
Right. So, in the state of Massachusetts, and really any state in the U.S., a client can go where they want to go as far as physical therapy services. What I always tell people, even when I'm speaking to them and I'm talking about my own clinic, is find some place that is near you, find some place that you conveniently go to, and some place that you feel like you can keep a good follow-up and frequency with. You want to have a good rapport with your therapist. You're going to be spending a lot of time with them. You don't want to be living in Plymouth and going someplace in Quincy and sitting in traffic. You don't want to be going to somewhere where you're going to see someone different all the time. That's what we really try to, promote, is spending the time and learning with just one or two therapists, and I think that's a really important part of the process. So it's all about the consistency. In order for physical therapy to work, you need to consistently get to that therapist, spend the time with them, allow them to utilize their expertise, not only to exercise and do some manual treatment in the clinic, but also to get to know you as a person. What are you doing in your daily life? How is that affecting the injury at hand that we're trying to treat? That's really important. So yes, I think it's very important that people do know, because not everyone knows. Some people are the culture of, I'm just going to listen to whatever my doctor says. We really should take accountability for our own health. So it's very important to make sure that you research where you're going and whether it's going to be a good fit for you.
Okay, and you had mentioned the different kinds of services that you have there. So you could go for, say, a knee injury, but also, how to reach the can off of your counter, kind of occupational.
So in terms of therapy, we offer 3 disciplines. One being physical therapy, which I'm a physical therapist. Another is occupational therapy, and the third is speech therapy. Now, physical therapy and occupational therapy, depending where you would go, those disciplines overlap in a sense. Mm-hmm. Speech therapy is their own entity. They deal a lot with adaptive communication, the ability to swallow, the ability to speak, and they deal with some cognitive, as far as some, no, see, I'm not, so there's no words. We'll skip that part.
Okay.
Occupational therapists deal more with, on the inpatient side, with more with ADLs, adaptive equipment, and so on and so forth. Some occupational therapists on the outpatient side deal more with wrist, hand injuries. They're able to utilize adaptive equipment in that sense. Physical therapy, we basically treat head to toe. We deal more with mobility, functional capacity, getting your pain down. I tend to tell people that the job of an inpatient physical therapist is to get you home safely. Some people may go to home therapy after that, and their job is to get you out of the home safely. I mostly tell people that as far as an outpatient therapist, our job is like the finish painter. We're going to be dealing with your pain, how you can deal with your job-related duties, your household chores, and activities that give you enjoyment, recreational activities. We're really getting you back in the community and get you back where you want to be. For some people, that may be just taking care of their young grandchild. Other people, they may be a firefighter, a postal worker, a school teacher, or perhaps they work in a factory or they're expected to lift a certain amount. We want to make sure that by the time they leave us, they're as close to that as possible.
And is there a set amount of time that a person can go to therapy? Is it contingent on your insurance, or how does that part work?
So therapy, as far as duration, frequency, is determined by your physical therapist, occupational therapist, or speech therapist on your first appointment. At that time, they do an initial evaluation. It usually takes about an hour, sometimes can take a little longer. And what they're looking at is all the issues at hand, taking that subjective and objective information and learning about that patient and their goals and making a duration, frequency of treatment. That is one part of it. The second part is your insurance. So some people's insurance only allows them so many visits per year. I always urge that people really understand what their insurance covers. And although it is their responsibility, I always do my best to make sure I guide them through that process. And what we want to make sure that we do is that we utilize that treatment so it's responsibly used to get that person as close to those goals we want to get them to. So, for instance, if somebody only has 20 visits that they're allowed per year through their insurance, and let's say they had a shoulder surgery, they may, after a surgery, only have certain things they can do. So perhaps on their protocol, they can only do passive range of motion. What we want to do is we want to get them to that place where they're ready for the next step of their protocol when they get to strengthening. We don't want to use all their visits before they get to the 20. So we wouldn't have the person come 3 times a week. We might have them come once a week, once every other week, until we can progress them along and make sure we utilize it in that sense. So someone after a total knee replacement, perhaps they don't have a lot of range and things are in tough shape. In that case, usually we really want to get them in there quickly. We want to up the frequency to like 3 times a week and get that range before we get out of that window where that soft tissue and that scar tissue is starting to really become in its permanent place. So I always tell people that scar tissue is like gum on the sidewalk. When it's first dropped and you step on it, it can kind of go every which way. But as time goes on and the sun beats down on it and day and night comes and goes, it starts to become part of that pavement. And what happens is now this knee is harder to really move, and they're looking at more than physical therapy to get that range that's really important for the functional mobility, getting up and down stairs correctly. So it's really, you have to consider when you're working at the frequency and durations of the patient of number one, what can they tolerate? Secondly, what's their insurance and how do we have to deal with that? But thirdly, really, where are we going for as far as goals and where do we need to get this person to so they can get back to their daily activity safely? And if it's a job that's heavy lifting, it may take longer. So usually people are in therapy anywhere from a month's time up to 6 months. Now there are people who are on the extremes of other ends. I've had people who've come to therapy for 2 visits and then they're done with me.
Not because of you, because they're better, right?
Yes, because they're better. So perhaps somebody just needs a little education.
Yeah.
Education's a very important part of therapy. There are times when people think that there's a major issue going on, and through the evaluation and spending your time with that person, you realize that it's a simple thing that they're doing in their daily life that's keeping that issue going. It may be that they talk on the phone every day at work and they're experiencing some numbness in their arm. Well, what we want to find out is what are they doing in their daily life and at their work schedule, what does that look like? So we want to recreate that. It's very important that during a physical therapy evaluation or an occupational therapy evaluation, at all possible, if we can recreate those symptoms that person's having and then figure out how to take them away. Now we have not only convinced that person that the therapy's important, they show up for the consistency part, but also as a therapist, I have a clear idea where I need to take it to the next level. One of the last people I had for just a couple of visits happened to be somebody who was on the phone a lot and they were just resting their ulnar nerve perfectly on the desk they were talking on. What I recommended for that patient was to stop putting their elbow on a table, and it was that simple. And if that was going to hurt their shoulder and arm, that they should invest in a headset. So rather than spending months with me and trying to do nerve glides and work everything out and strengthen them, it was a simple just piece of advice. Don't put your elbow on a table.
Okay, so then that brings me to the next question. If I am noticing that I'm getting numbness in my arm, how do I get from that point where I'm sitting at home saying ouch to being able to go to a physical therapist? Like, do I have to call a doctor?
I mean, if you're having neurological symptoms, whether you're having numbness or paresthesias, it's a very serious issue. Beyond hitting your funny bone or your arm falling asleep, like we talked about talking on the phone, something like that can be very serious. So what you want to do is you definitely want to call a medical professional. You want to call your doctor or nurse practitioner or go into a walk-in clinic and just have someone take a look at that. If it's deemed necessary that you do in fact need physical therapy, then they're going to take you that step. I will tell you that physical therapy has no side effects beyond working hard, feeling better, maybe getting a little more stretched out and learning more about your body. We're a very medical, pharmacological based society where everyone says every once in a while, isn't there a pill for that? Unfortunately, there's not a pill for everything. Some things still take hard work, dedication, and knowledge of how to fix it. So sometimes it could just be a matter of they need to give the person a medication to get the symptoms by so they continue with their life. But did that address the issues at hand that are causing that impairment? If we give someone prednisone and it takes down the swelling around the area, great. Now they can get on with the daily life and they're in less pain. But what brought them to that point? Really, that's why I like physical therapy, occupational therapy services, is because we really get to know that person, spend the time with them, learning what they do at home, what they do at work, and looking at them as a whole person physically and getting them to the point where they need to be. There are times when we have to refer out because we can't help people because perhaps they need a little bit more before they come back to us. Perhaps something is damaged beyond the point where I can help them with exercise, stretching, and education, particularly if their job is very demanding. But it's always a great place to start. And research has really shown, especially in the last decade, that it's very important for someone to have a good surgical outcome to go to therapy prior. So if you're gonna have a knee replacement, make sure your range of motion, your strength, and everything's best it can be before you go. Because now you're recovering from that surgery with that decent strength and the range of motion. The surgery enough is a big deal. You're gonna be sore. And I hate for somebody to see someone who's that sore have to gain all that much in that short amount of time. We talked about that gum on the sidewalk analogy.
Yeah.
So, please be an advocate for yourself. You want to make sure that you're taking care of yourself. As far as I know, this is the only body we get. So we want to respect it, we want to learn about it, and make sure that we can take care of it the best we can. The more you know about it, the better you can take care of it.
Another thing that we had talked about prior to this was I forget what it was called, but it had to do with lymph nodes.
Yes, lymphedema. So not only do I work at Plymouth Rehab and Healthcare Center, but I also work at Cape Heritage, which is a skilled nursing facility, and it's in Sandwich, Mass on 6A. It's just right over the bridge. And one thing that I really wanted to make sure that we did as outpatient facilities was to bring things to the table that I saw where people were underserviced. One thing that I really feel that was underserviced in this area was lymphedema. So I thought back to the clinic I worked at prior. I worked down the South Coast, and we literally saw, you name it, A to Z. But there was a couple things that we didn't do. One being lymphedema. And when someone has lymphedema, what it basically is a collection of protein-rich fluids that have collected someplace in the body in the extracellular space. And you'll see this typically after someone has a mastectomy or they've had some lymph node removed. And what happens is the arm gets very swollen. So you can imagine that someone who has their arm that's the same size anatomically that it should be has some problems with the shoulder, now add 40, 50 pounds to that arm. Lymphedema doesn't get better by itself. It's not like a time thing where it resolves. It typically gets worse. And the extreme cases you might see is like the elephantitis kind of swelling, where you see these large hands and these legs that are bulbous, and they almost look like they're someone else's. That can be very difficult for somebody in the community as far as their self-image. And it also, unfortunately, because it's so protein rich, can really bring on an infection. So what we want to do with those people is we want to get that lymph back to the healthy lymph system and back to the heart and cycle through the body, and then fit those people for a custom garment to keep that down. Now, this is something they have to do for life, unfortunately. I myself am not a certified lymphedema specialist. It's important that we have some of those on staff, and that's why we didn't offer it. So what I was lucky to do was I was able to get 2 therapists, an occupational therapist and an occupational therapy assistant, who are both lymphedema certified. That allows me to treat that population, which I think is great, because I truly feel like they were underserved on the K-band and Plymouth area. And I really didn't know who to refer out. And a lot of times when I would refer people out on the South Coast, it was to one therapist who had like a 6-month waiting period. Now, if your arm weighs 30 pounds more than it should, it makes it very difficult to do small tasks. So unfortunately, it was very difficult for these individuals, and I felt like just to give them a wait for 6 months, it just wasn't acceptable. So that was one of the first initiatives that I really wanted to get going as far as Sandwich. I think that's great. It's a short drive from Plymouth. The therapist stayed there. If somebody was really in a tough predicament, I probably could get one of the therapists to come down Plymouth area. I would be willing to work with that, but I think that's great. We also do pediatrics. Like I said, we kind of do A to Z. The one thing we really don't do in Plymouth is we don't have a certified lymphedema specialist that's on staff full time. But we deal with pediatrics, both with cognitive impairments and not with cognitive impairments. We deal with the young kids who have sports injuries, and we also deal with people who might have had a joint replacement who are in their final decades of life, where they just need some education to deal with the arthritis and how to do things a little differently, and to be feeling better, to be able to do things that they enjoy. So it's a rewarding profession, and I think we have a very good staff who are all motivated, and they're very patient first. They want to see that patient get better. We really don't get any satisfaction from our job unless we get the people better. So, we take it personally, and I think it's a very rewarding job. Anytime you can take somebody and without drugs or without major surgery, and you can just teach them about their body and you can better their life and overall wellness, it's a great feeling.
You keep mentioning education, and I did want to get into that a bit as far as what you can do. I mean, this show is obviously geared more towards people who are over 60, but even someone younger could benefit from learning these things about their body and the stuff that you can do before you get into a situation where you need the knee replacement. Is that correct?
Yes. So we don't want everybody to get to the point where they need to come see us. Some people just need some quick education. So what I've tried to do is I've started to partner with some of the local council on aging and go out in the community and just provide some free educational courses. So what I've been doing is I started with a stretching program last month, and we did Plymouth Council of Aging, Sandwich, and Bourne, and they went quite well. And I'll also be bringing that to Kingston, which is great. And that program is called Stretching Towards Wellness. And what we did is we just made an all-inclusive stretching program that really covers people from all ranges of mobility. So someone who might be wheelchair bound, to someone who's using a walker, to someone who's perfectly healthy and hitting double diamonds, in their 7th and 8th decade of life. So we just brought them to some stretching. And it's a a hands-on class as far as going through the stretches yourself. And some of the people who need a different way to do it, we showed it to them. And then what I like to do is I like to do like an open question and answer. Kind of ask a therapist, spend some time with them, and educate the people. So that's something that I've started in the community, and I think it's great. It allows me to give back to my community, but also to help someone out. If they need to come see me, great. If they don't, then great too. You've been able to help them out, and that still gives you that satisfaction.
That's awesome. We're actually running out of time. I'm kind of bummed about that because this is a great conversation. But we do look forward to having you at the Kingston Council on Aging. The dates will be determined. And I do want to thank you for being on the show. This has just been an awesome conversation. And I'd like to thank all of you for joining us, and we'll see you next time on Young at Heart.